Good evening, everyone. Thank you for joining us again on Advocacy. Today is September the 19th, and we are happy to have Frank and Sherine Padgett with us tonight. I want to start off by saying my name is Paula Armstrong. I grew up in the DC area. I currently live in the Maryland area. I'm married with two kids. Jeremy's 24 and Morgan Pop just turned 20. Yay! So, and Morgan was born with multiple disabilities. Her main one is cerebral palsy, and she's also autistic.
Well, hello everyone. I'm Crystal Francis. I reside in Michigan. I am married with five children, and three of my kids do have diagnoses. And I'm happy to be here tonight. So, welcome.
Hello, everybody. I am Bunny. I am married with three adult children. I live in Maryland and I advocate for my lovely grandson, Grayson, who is autistic.
Okay. Well, thanks everybody for their introductions. We'll turn it over to Frank and Shireen to tell us a bit about yourselves and your family.
Okay. You wanna go?
Okay. Hello, everyone. I am Sherine Padgett. This is my wonderful husband, Frank. We are native Washingtonians, grew up the first 50 years of our life in Washington, D.C., and now we live out in the suburbs of Northern Virginia, about 50 minutes outside of D.C. And we have two beautiful children. Our daughter, Ashley, she will be 30 in a few weeks. Our son, Trey, Frank Padgett III. He is now 26 years old. He's married with our two wonderful grandchildren, Legend, who is 10, and Echo, who is 3 years old. Frank?
And I'm Frank Padgett, and as Sherine said, we were born in DC. I was born in DC. She was too. The kids were as well. Um, like as she said, we live in out of Northern Virginia now. I guess did you say how long we've been married?
No.
Okay, yeah, we've been married for 33 years.
Wow, awesome.
3 years. So June 1st of next year will be 34. And
Okay.
the time has flown by, so it doesn't seem like a long time. It's just you look at the kids, just like where'd all the time go? But we're definitely excited to be here, and we definitely appreciate the invitation and the work that you all do is amazing. Because the community that you all are establishing to create will do a lot of good for a lot of families.
Yes.
Well, that's good to know because, of course, advocacy is definitely trying to bring awareness to several to the community about the different disabilities. Because I think disabilities, if you don't wear them, you don't look like you have a disability. For the most part, people don't think that you have a disability, and you shouldn't have to scream it from the top of the building or wear a sign that says, "Hey, I have a disability." So that's why we are definitely trying to bring awareness to um, the various disabilities. So with that being said, we did have their daughter on here, Ashley Pageant. We had her, I want to say it was sometimes last year. And Ashley talked to us from the perspective of being a young adult being born with a disability and how she had to endure various things. So we thought it would be interesting to have Frank and Shireen on here with us because what they're going to do is talk to us from the perspective of having being parents of a child born with Dandy-Walker syndrome. So I know we've heard the definition from Ashley, but can you guys give us a definition of Dandy-Walker malformation, and then tell us the beginning. Tell us when she was diagnosed. Tell us when you were going through your pregnancy. Just give us some information on that.
Okay, you want to start
Okay.
off?
Go ahead.
You want to do it?
He can. We love to hear him speak. Go ahead, Frank.
No, so as you mentioned, Ashley, she has a condition or was born with a condition called Dandy-Walker malformation. And
Mhm.
what it is, simply, it's a malformation of the brain, wherein, in her particular case, the rear portion of her brain, her cerebellum, never developed as it should. So when she was born, she, you know how babies have like the soft spots in the top on the top of their heads. She
Mhm.
actually had a soft spot. The whole back of her head, including the top of her head, was a soft spot. and it was just like a cyst pocket or a pocket of fluid that was there. Um, Now, you all have talked to Ashley, and we've been thoroughly blessed, and God has done amazing things in her life. But just we didn't, when we first heard of this term or diagnosis, it was when Sherine was 4.5 months pregnant, and so I remember we were actually at church one Sunday, and we were in the choir, and Sherine was singing, and then towards the end of the service, she was really, really feeling bad. And she was feeling so bad that I had to take her to the emergency room straight from the service. And she was just like, I don't know what's going on. Something's wrong. Something's wrong. And of course, we knew she was pregnant. So we're just like, okay, let's go to the emergency room. So we went to the emergency room, and within they started running tests and stuff like that to try to figure out exactly what was what. And I think it was like the next day or something. Yeah. So they kept her over, and they admitted her. They kept her overnight. The next day, her doctor walks into the room, and he was the head of the OBGYN at this particular hospital. And he said to us, he said, well, we don't know what's causing these pre-labor contractions. However, the baby has a condition called Dandy-Walker Malformation. And he kind of looked at us. And I said, well, what is that? He said, well, it's a malformation of the brain and stuff. And he didn't go into too many details. And he said, it's very rare, and we don't know a lot about it. And, but it's time for you all to make some decisions. And he said, and that decision is, do you want to terminate the pregnancy?
So they did a sonogram to determine that?
Yes.
Yes.
That's how they could see that cyst. It was so large.
Yeah. So this, as Sherine said, the cyst was so large, and so that's what he told us. So of course we're there stunned. Sherine's laying in the bed, and I'm standing on the side of the bed, and we're listening, and we're just stunned. We don't know what to think.
It's your first child, and
first child. Now I will say, prior to Ashley being conceived, Sherine had a miscarriage.
Right. I actually, I was pregnant 7 times.
Right.
I lost 5 children, naturally lost them to have my 2 beautiful blessings. Yeah. And so I thank God for Ashley and Trey. That's why I hold them tight so much. I lost.
I didn't know it was that many. Sherine, I had no idea. I remember, I think 2.
Wow.
Yeah, 5. But go ahead, Frankie.
So as we were standing there, the doctor, as he was walking out of the door, I called his name and I said, hey, can you get us some information on exactly what this is so that I can research it and we can understand it better? And he said, yes, I'll bring you something. And he looked at us and he said, but you got to think seriously about what you want to do with this pregnancy. Do you want to terminate? And I remember I said to him, I said, I don't want to call his name. I said, doctor, I said, we believe God.
I know that.
I said, we don't understand. I said, but we believe that God has the power to heal. And he looked at us and he was like, okay. And he walked out the door.
People. Yeah.
And as he walked out the door, we were just like sitting there. We were stunned. And then we just cried. We just cried. I mean,
that's real.
And I'm crying. We're both crying, and we cried for about 10 minutes.
That's real.
But at the end of the 10 minutes, I said to Sherine, I said, okay, listen, enough crying for now. I said, it's either we're going to trust God or we're not. And I said, we need to just trust God. We don't understand things, but we need to trust God. And later on that day, he came back in and he bought me a textbook that had like maybe 2 pages that talked about what Dandy-Walker Malformation. And Dandy-Walker is actually named after 2 doctors who I guess found this malformation. And it was like literally 2 pages in a textbook, and it didn't really say a whole lot because they didn't know at that particular time. They know more now, but at that particular time, they didn't know more. So that was, us starting out finding out that here we are, we're so happy that
Mm.
she's pregnant, and then now there's pre-labor contractions, and we can't they can't explain that, and then on top of that, it's like they give us this diagnosis, this gut punch,
Mm.
and we're like, God, what is going on?
Mm.
What is going on? But that was the beginning, and like I said, God really blessed us, throughout that 4.5 month period down up until the time of delivery. Now I will say this, and Sherine can attest to this. We because Sherine was placed on bed rest, but when we went home for the rest of her pregnancy, he wanted to see her, was it once a week, and then it got to like twice a week or something like that. So because he wanted to constantly monitor her to make sure that her and the baby were fine. Well, the other thing that they were telling us within the first, before we left the hospital, the first time we went, they said, well, because I asked the doctor, I said, what are the chances of the baby being born, normal, you know? And he said, well, he said 50% of the 50% of the babies that are diagnosed with it, they die. They're stillborn.
Oh, wow.
Hmm.
He said
Mm.
the other 48%, he said they have severe mental retardation issues, or just severe issues. He said then of course science isn't 100%. He said so there's always that 2% grace period. And I told him again, I said, we don't understand it, but we believe in God.
Mm.
And but throughout, and it seemed like almost every doctor's appointment that we went to, the only thing that we kept hearing, terminate, terminate, terminate. And it got to the point where I said to the doctor, I said, listen, I said, I don't believe, I said, I'm not the giver of life.
Mhm.
I said, so if I'm not the giver of life, it's not my responsibility. It's not my job to take it. I said,
Mhm.
if God wants this baby not to be born, so be it. I'm good with that. I just want
Mhm.
his will to be done.
Like he did all the other ones.
But if God
Yeah.
wants,
Mhm.
if God wants this baby to be born, then we will deal with whatever He gives us,
Mm.
and we'll go from there. So from the very beginning, that has always been our stance, and that's where we stand to this day. So sometimes, and what I've learned from that is sometimes people see a situation and they think that it's hopeless, and
Mhm.
they feel like, well, if just do this, then it'll make your life so much easier. But I'm gonna tell you one thing, my children, I love my children. The- you know I can't even explain the love that I have for them. And sometimes
Mm.
I say to Ashley, because we're very close, sometimes I say to her, I said, and you were the one that they wanted me to terminate.
Wow.
And I just think about it. I think about it. I was like, man, I would have missed out on,
Yep.
or we would have missed
Oh my goodness.
this moment,
Yes.
this moment. And here it is. God has blessed her, and she's had 21 brain surgeries throughout her
21.
life. But God has blessed her. She's gone through school. She's top student in school. Went
Mm.
to undergrad, got her undergraduate degree. Went to graduate school, got a graduate school degree. And here she is. We started a family business, and I'll get into that as the reason why later. But we started a family business, and she's a partner in that. So I'm like, look at what God has done, and I'm just like, I don't even want to think what it would have been like if we would have made that decision and we
Yep.
would have missed out on all
Missed
the things
out.
that God had for us.
Yeah.
That's
Wow.
amazing. That's
That's a
amazing.
miracle within itself. That's
Yes.
2%. She made that 2%, huh?
That's right. That's right.
2%.
That's right.
But when I just say I just take such joy in hearing you guys testify to the blessing that your daughter has been to you all. And I'm sure you feel like this because I feel like this about Morgan. I thank God that he entrusted that miracle to me.
Mhm.
He looked on high and said, "Listen, I'm going to entrust them. I trust them with this miracle
That's
to
right.
see that thing through." that means so much, because I think at times it is, I ain't gonna lie, it's human to want to take the easy way out. It's
Yes.
like, when I don't know the unknown, who wants to walk down that road of not knowing the
That's right.
unknown? So it
Yeah.
is easy to take that easy road out, but it would be wonderful for that doctor that you talked to when you took her to the ER to see the miracle that
Yes.
Ashley is. That would be a blessing.
Now, I will say this too, because when Sherine and I, when she was still pregnant with Ashley, and we were going like once a week, then it got, as they got closer, 2 times a week and stuff. So her doctor, he was the head of his department. We developed a good relationship with him.
Mhm.
And so in the beginning, he looked at us like, okay, yeah, y'all on something else. But then we developed a very close relationship with him, and it got to the point where in the 9th month, Sherine started losing amniotic fluid, right?
Mhm.
And so he came to us, the doctor came to us and said, listen, he said to me, he said, Frank, he said the baby would be better outside of the womb than in the womb, because this amniotic fluid is being lost. And so that means the environment is becoming smaller and smaller for the baby.
Mhm.
He said, you might want, he said, we feel that it's better to get the baby out, and we'll schedule the C-section, and you can do that. And he said to me, he said, I want you to go home, pray about it. He said, I'm on call all night tonight, and you can call me and let me know, and you can come in here and we'll get it done. That's what he said to me.
Same
Wow.
So
doctor that said terminate. Now he's saying go home and pray about it.
same doctor, same doctor. So on my way home, I mean, I'm just don't know what to do, because in my mind, in our mind, sometimes we go through different things, and we pray about things, and we read our Bibles, and it's like, oh, we could pray about this and we could pray about that, and God is just going to do it at the snap of a finger. That's not always God's will.
No.
It's not.
That's not always His will. But honestly, that's what I was looking for.
Mhm.
That's what I was looking for. And I'll get into why a little bit later. But so I remember I had called my mother, and I told my mother all this stuff that was happening. And I said, and at that, the other thing too, I didn't say what the doctor told us. He said, well, the amniotic fluid is decreasing. He said the baby is in a frank breech position. So instead of the head being facing down, her butt was face down. So that means that they would have to turn her and all this other stuff, and then deliver her through natural childbirth. So I told my mother, I said, Mom, I said, I need you to pray, and I need you to pray this and this and this. So I told her that I was feeling good. So she said to me, she said, I think you need to change your prayer. And I was like, what do you mean? She said, I think that you need to ask God to let His will be done. So I said, okay. So late that night, I told Sherine, I said, it's time for us to go in. I said, we're going to call the doctor. I called him like 11 o'clock at night. He said, can you be here at 6 in the morning? I said, yes, we can. Got there, got Sherine prepped. You ready to go? I'm in the operating room with her. And he goes to do the C-section. As he's doing the C-section, now Sherine isn't asleep. She's still awake. I'm standing there at Sherine's head. I'm looking at, from the first cut to the last stitch. And I'm just looking. And when he started pulling her out, what he didn't see and what the scans didn't see is that the umbilical cord I saw him like he had his thumb and he was just trying to maneuver and stuff. And I was like, what is he doing? Well, what he didn't know is that the umbilical cord was wrapped so tightly around her neck that had she turned, that could have she might not have made it out alive, or it could have caused greater damage. And
she was being strangled.
Right, she was been strangled in the womb, and because she had that soft spot on the back of her head, had she come through the birth canal, she might not have made it.
Wow.
So
and how many months was this?
This is in the 9th month.
It's
We
Oh,
ninth
were
month.
okay, you went 9th.
Yeah, I'm
Okay.
following the story. This was ninth month right here.
Yes.
we were in the operating room, and the C-section is going on when I'm seeing all of this. So once everything is done, myself and the doctor, we're walking out the operating room, and he said to me, he said, Frank, he said, doesn't God work in mysterious ways?
Oh, wow.
I said, yes, sir, he does. So it's just, some of those prayers that we start praying,
Yes.
we start getting so specific, and we forget that, hey, God has a will. We need to figure out what that is, or ask him what that is. And if he doesn't even give us an answer at the moment, be patient, and that stuff will be revealed in time. But I know for me, in the beginning, when all this stuff started happening, I was just like, Lord, why is this happening? What did I do? What did we do? What did all of this? I'm having these pity parties, and I'm just like, snap your finger, Lord, just
Where's the miracle?
yeah. I want to
That's normal.
down
That
stuff.
is.
Yeah, it's normal.
It's real life. It's real life. Even as believers, it's like I'm a believer. Oh yeah, God gonna do it this way, and
That's
he
right.
like, no, I ain't.
That's right.
Yeah,
I'm
I'm
gonna
glad
take
you
care of
said that, Frank, because
it.
I want people to understand that we will go through things
Mhm.
and still be
Yes.
saved, and God is going to move and answer in his own time.
That's right.
Mhm.
That's right.
Yeah.
Yeah.
And I
Yeah.
was now here we are, as Frank said earlier, 21 brain surgeries later,
Yes.
30 years later,
Yeah.
and God is still God, and he's still doing it his way, and it's still a miracle. So
Yep.
sometimes he don't just do an instant miracle, but he walk you through it, and he works the miracle one behind the other as you take the next step and the next step, and you look back and say, wow, look at how far God has brought me. He's
Mhm.
done A,
Yeah.
B, C, D. You count your blessings, and sometimes when you're in it, the pressure and the stress and your knowledge of what you know
Yes.
overwhelms you, and
That's
you
right.
forget that God is all knowing. He knows it all. He has a
Yep.
plan. He is the logos, the word, the thought, the plan before the foundations of the world. So he knew who Ashley was before she was in her mother's womb. And she was fearfully and wonderfully made. And the fact that God did that, he created her just the way he wanted her. And he
Mhm.
worked it out just the way he had planned. And it's marvelous in our eyes. All of you have witnessed the testimony and the miracle,
Absolutely.
and I thank God. But if we would have done things our way,
Right.
and
Yeah.
if we would have only saw from our perspective,
That's right.
we could have terminated the pregnancy
Mhm.
and been out of God's will.
Mhm.
We could have forced them to go ahead, turn that baby, do whatever you got,
Mhm.
turn that baby, and killed her. We could have forced our desire for natural vaginal birth, and
Mhm.
her bone would have been crushed because she didn't have strong enough bones to come through the birth
Mhm.
canal. So God sees beyond us. His ways are higher than ours. His thoughts are far beyond ours. So I just want people to know that whatever you think, remember, God thinks greater and more. Whatever
That's
you
right.
you perceive, God perceives it far more than you think that you know. But like they used to say, you knows nothing.
Knows nothing. Knows nothing.
So you
That's
just
right.
Nothing.
say, Lord,
Yeah.
it's in your hands. You know it all. I'm just here. Lead me and guide me. Like Frank said, we would have that pity party of why me?
Mhm.
Yeah, who
And
don't?
get to get pregnant. My thing was, and that was Frank's perspective. My thing was, Lord, I committed my life to you. I'm serving you. I did it the right way. I'm not running around, sleeping around. I waited till I got married to my husband. Me and him didn't do this, that, and the other. We did as the church said. And, we're in church. Now, all these other people, they just popping babies, getting you can't find the daddies. They don't know who the daddy is. And we trying to do it the right way. And I'm losing 5. And I'm like, Lord, what is wrong? Do you love me like you love the others? Like, what did I do? Like Frank said, why me? Why can't I have a baby? We strive to do this, but it's not my righteousness, it's God's
That's right.
will.
Right.
So he gave me the 2, and I thank God for the 2. We were always in the hospital. We lived the life of hospital, 21
Yes.
brain surgeries. Come on. And that's just the emergency brain surgeries, guys. That's not all the specialists.
Right.
That's not all the doctor's appointments. That's not all of the procedures that she had to get. That's just counting the brain surgeries. And so, to answer your question in the beginning, Paula, what is Dandy-Walker malformation? It literally is your cerebellum, either it's missing or a large portion is missing.
Right.
And in Ashley's case, a large portion was missing. I mean, it was huge. It was from ear to ear, straight back. All of this that's supposed to be brain and your cerebellum was a big pocket of fluid. So you could take, and I remember her goddaddy, Bishop, he took a flashlight. He went to his house, took a flashlight, and you shine a flashlight from one side of her head and it shines straight through to the other side and onto the wall.
Wow.
There was like no brain. And so it was a severe case. And so God is good, but the cerebellum controls movement, coordination, learning, your speech, just all sorts of things. And for that to be missing or a large portion missing or suppressed, then when a doctor says only a 2% chance to be normal, that is serious. And God worked a miracle for her to come out in that 2%.
Right. And
the fact that throughout the years, she's even with her APGAR scores, when she was born, they take the scores to see how the babies do. And thank the Lord, she was
9 and 10s.
And all nines and tens, and that's the highest. So we were like, God, I thank you. And so throughout her life, the Lord has blessed her. She's had a lot of medical issues because of all of this, but she's always fared well. And it's been by the grace of God to do things like this, to give a platform, to give him glory, to give him honor, to have her 30 years old and a 30-year track record of all of you witnesses to say, I know that God is the real God. I know that God is the true God. I know that God is a miracle worker. I know that God is a prayer answerer. He is real. You all are the testimony. So from the beginning of the world, she was predestined to go through this with us. And all of you to witness it, for him to have a platform like this that is forever archived for generations, as long as the internet exists. And they say, wow, God, you could do that. Later on, God has started to either grow in her cerebellum, which the doctor said, whatever
That's what I was going to ask.
Right. You grew that
brain you're born with, that's what you have for the rest of your life. Does not grow in. It is impossible. Hers, either it started growing in that wasn't there, or it was so suppressed that it started expanding. The doctors could never figure it out.
Right.
All they knew is this is a miracle. And we ran away with this is a miracle. But we were the one of those, those 10, and one came back to say, Lord, I thank you. We still coming back on here saying, Lord, I thank you. You work. You will never forget what you've done. Now, I will say, when Frank said that the amniotic fluid was low and she was stuck in what they call the Frank breech position, that means her feet was like this in front of her face. And she was turned the opposite way, but her legs were straight up and down in front of her face. She was stuck like that for a long time on the side of the wall of my uterus. So when you see her whole life and you see all of that hemangioma, so just so people would know, hemangioma is blood vessels that's more topical. They're more on the surface, so you can see them. All of us have blood vessels in our face, neck, nose, mouth, and all of that, but you can't see it because they're deeper suppressed. Well, because of the lack of the fluid that stuck her to the wall like that, her blood flow wasn't flowing as much. She wasn't being as developed on that side. So her blood vessels formed more to the top surface. And that's why everyone could see all of this, red spots down her neck, is her nose, her eyes, her airway. Her ear didn't fully form as much when she was born on that side. And so it's a lot of small things that all add up. Now, subglottic hemangioma is inside your airway, and that was blocking her airway 70%. So 70% of her trying to breathe, whenever the blood vessels would swell, sometimes they would go down, sometimes they would swell. And when they would swell, then imagine your airway being 70% blocked already. So that was an issue. And then she had what you call tracheomalacia. That's like an extra flappy valve, like within your airway. It just flaps, and sometimes it closes off your valve. So she had that going on with the tracheomalacia. So she was on breathing machines and oxygen machines and things. We would leave her with her other godparents, another bishop, and we went to a marriage retreat with the church, because I never leave my baby. I mean, if I have to stay sleeping in a chair for 3 months doing her brain surgeries, I never leave her. So we left her for that weekend. And sure enough, we got calls because we had to leave breathing machines and oxygen machines. And, so you feel bad leaving your child with all of these issues with someone. But we got calls while we were there. And I'm like, I need to get back to my baby. I'm glad we took a break. But, it's real life. So you got to deal with real life. But she had all of that going on. And it affected her vision. So she was declared as legally blind. So she had her glasses when she was 1.5. I remember that. We went to the pastor's banquet. I still have pictures. And she was 1.5. We dressed her up so cute with her little dress at the pastor's banquet. It was her first day. She just got her eyeglasses a few hours before. And so that is just a treasured picture. But yeah, her right eye, it has like bifocal in her lens. It's different than the left eye because she was counted legally blind. And and I'm almost done, but because of all of the medical surgeries and all of the medicine, then one of the medicines, I won't say the name, but it causes hearing loss when you have too much. And of course, you're a tiny baby having all these surgeries back to back to back, but she needed the pain medicine. And it was not just pain, but it was also antibiotic. So, but that particular medicine caused her to have 50% loss in her right ear. So she was 50% deaf. And so she needed a hearing aid. And so, of course, as she got older, she didn't want the hearing aid and wouldn't want to wear it. We would fuss at her. She was like, no, I don't want to wear it. And after a while, as a parent, and parents listen, you have to remember, like Frank used to say, they're not doll babies. They're real people. Real people with real feelings.
Yes.
Yes.
You already have to feel like, if I'm feeling, why me, Lord? And Frank feeling, why me, Lord? Well, we're not Ashley. Imagine Ashley feeling, why me? People think I'm different. People look at me funny. Why am I always in a hospital? Why am I always hurt? People treat me special. And I just want to fit in, So now and then, in pre-kindergarten at 3 years old, she come home saying, all the children keep asking me, what's this on my face and what's wrong with me, And so we always built her confidence and her self-esteem. But then now to add a hearing aid to that, she already have, part of her ear not really formed. So looking at her, you could see, something maybe going on. But now mom and dad is forcing her to wear a hearing aid. And so from the parents' perspective, because this is about the parents' perspective, right? Yeah. Like, my baby is going to hear, she's an honor student. She's going to stay honor student. She missed all the school year. Every year she missed half the school year for all the surgeries. So she got to sit at the front of the class and have the hearing aid on, and the teacher have a microphone that goes right into her hearing aid. That's our perspective. We're going to accommodate and give our baby the best.
Absolutely.
The best parent, because all this stuff is sometimes it feel like living hell. Like, Lord, I don't have to wait to go to hell. It's like living hell. What's going on? Yeah. But that's your
I know that was hard for her.
That's tough. But then look at it from the child. The child is like, I just want to fit in. I just want to feel normal. I'm not wearing a hearing aid. Even if I can't hear the teacher, I'm not going to wear it. And so parents, consider the children. And she was younger then, and as she got older, she was like, I'm not wearing it. I don't care what you say. But just always consider the children. But anyway, those are all of the different nuances to surrounding not just the brain. And I didn't even mention the shunts. You know about the hydrocephalus with all the shunts to actually drain brain fluid that gets stuck up on your brain. Our bodies naturally drain brain fluid. It flows up and down our spinal cord all day long. But when you have hydrocephalus, that brain fluid gets stuck up there and it piles up more and more. And your skull is not going to grow and expand. So what happens is that fluid just starts squeezing and crushing your brain, because your brain is a muscle and tissue. So it squeezes that, and if it does it too much, it can kill you instantly. So you have to shunt it. You got to get that fluid down. So they put a shunt in, which is like a straw-like device. They put it under the skin, and then it drains the fluid from the brain down into the stomach or the chest, and then the person is relieved. Well, Ashley had to have two, the big cyst in the back. So the shunt went from the back cyst down her chest into her belly. And then the ventricles, the brain, the two sides of the brain have ventricles, and those were swelling with fluid as well. So she had a shunt at the front, at the top of her brain, to go down alongside her neck and drain. So I'm going to stop because
Yeah.
I'm talking a lot, but that's
Oh my gosh, Sherine, you gave
Yeah.
us a lot of
Right.
details that
yes.
really
Detailed, I'm sorry.
explain.
Yes.
No, you did. I think we definitely, first of all, we were all sitting here hanging on.
Right. Right.
This is such good information for us to understand. And we've had since Ashley's, when she came on the podcast, that a parent reached out and said, I have a child with this. And so you're just really explaining this with such good detail and giving us a better understanding. And we know parents have a different perspective than the child. The child's probably like, well, when I was younger, my mom said this, my dad said I was in a hospital, I did experience this. But as the parents, and I mean, you touched on so many points.
Yes.
And I just want to say the point I was like holding back, the point where you said, why me? I did everything right. And everybody else out here, they loosey-goosey and their kids coming out. Woo, Lord. I had that when I found out my son had a condition while pregnant in utero, and that was my sentiments with that, I didn't think I had the strength. But,
Right.
As much as, we can look and give God glory for what he's done, what I also know in this journey, and I could see it in you and Frank's journey, is that it does something to your faith.
It
Yes,
does.
it does.
It does.
It does something to your faith in God, and you really learn it's really not about me
That's right.
and
That's
what
right.
I want,
That's right.
but and like you said, and then God gets all the glory. You
Yeah.
guys, woo!
Where's the
what I'm
medical
saying.
degree? Because all the medical terms, where is the degree needs to sit behind the wall.
Yes,
You become an expert. You become
you
you
do.
become your parents' doctor.
You do.
For real.
You do.
You do.
And I will say this to Crystal's point when Sherine was talking about the shunt. So when Ashley was born, before she was born, she was at Children's Hospital in DC, and we had met with we were at the hospital where she was born, and prior to her being born, Shireen's doctor said, we need to get you connected with doctors at Children's Hospital so that they can follow her. But what they're going to have to do because of this condition, as soon as the baby is born, because we didn't know she was we thought she was a boy, to be honest with you. I didn't know she was a girl until they were pulling her out, and I'm looking like, what?
Yes.
I mean, we
Because she was stuck like this.
yeah,
with her
we couldn't
legs
tell.
up, so you
They
can
could never tell. So I'm just thinking, it's a boy. We talk about, So, but anyway, so as soon as so her doctors, Shireen's doctors told us that as soon as she's born, we're going, and they had connected us with the doctors at Children's Hospital. So the head of neurosurgery there, we had met with them, and they were like, okay, so here's the game plan. As soon as the baby is born, we are going to do brain surgery, and we're going to put in a shunt, and we're going to do this, that, and the other. And we were like, okay. But as soon as she was born, her ABGAR scores that Sherine referred to, they were very high. They couldn't get any higher. So then the doctors were like, well, wait a minute. Everything that the medical textbook said that was supposed to happen, the opposite happened. So we were like, okay, Lord,
Thank you.
Thank you. So
Still expecting that instant miracle.
Right. So then I remember we were at Children's. We were sitting in the director's office, and he said, "Well, listen, game plan is going to change now." He said, "Well, she doesn't have the hydrocephalus because she has the fluid on the brain. She's supposed to develop hydrocephalus. That didn't happen. She was some other things was supposed to happen, that didn't happen." He goes, "Well, why don't we just wait a little bit?" He said, "Why don't we wait maybe a couple months, see what's what, and then we'll go in and maybe put a shunt in if there's a need for it." So that's what we did. So we brought her home, and we were fine. She still has this cyst, and she's functioning fine like any baby would function. And then at about 2 months, we took her in, and she wasn't having any issues.
But they wanted to remove the cyst.
But they wanted to remove the cyst because they didn't want it to cause any problems. So at 2 months, she had her first brain surgery, and that's brain surgery was to put the cyst in. Put the shunt in.
No, the first one was to remove the cyst.
Right. I'm sorry.
But of course, it grew
right.
back because it's just a sac.
Right, it's
and
a sac of fluid.
Fluid goes right back because all that brain fluid is just
So that was surgery number 1. So they removed the cyst, as Sherine said, fluid came back. So they were like, "Oh, we got to do something. We got to put a shunt in." So surgery number 2, they put the shunt in. Surgery number 3, the shunt got infected. So when the shunt gets infected, you just can't "Oh, okay, well, we can just fix it." No, you got to pull it all out. There's this whole protocol that they got to go through. It was like 2 weeks or something, antibiotics and all this other stuff. So we ended up being in a hospital. She ended up having 6 surgeries between 2 months and 5 months, 6 brain surgeries.
Because the shunts kept getting infected and breaking down.
Getting infected. And
the nurses wasn't washing their hands. So they would be like, we would say, "Well, how is it infected? What caused it?" They say, "Oh, well, the results say that it was fecal matter."
Yeah, and we were like, "What?"
The only people touching her is the nurse.
Right.
They were like, "Yeah,
Oh my goodness.
Yeah. So
watch your babies and keep them clean."
So for 3 months straight, we were in Children's Hospital. Now, I am grateful and I thank God for my wife.
Oh, thank you.
3 months straight, she stayed at Ashley's bedside. 3 months straight. I had to go back and forth, So I'm at the hospital every day too, but just not as much as her because I'm not able to be because of work and stuff like that. But 3 months straight by her bedside.
The love of a mother.
So when we finally go home, we're able to breathe a sigh of relief because at 5 months, we took her home.
7 years old.
And it wasn't until 7 years old till she started having these headaches.
Yeah, she just started complaining. My head hurt. I have a headache. And we were like, "What? You've never said that before." I have a headache. And then that's when we realized,
something's wrong.
It was getting more and more and more. We said, we got to take her in.
Yeah. So we took her back to Children's Hospital. But Shirine's mother, her mother-in-law, she kept saying, "Y'all need to get her to Dr. Carson. You need to get her to Ben Carson. You need to get her to Johns Hopkins."
She said, "He's the number one brain surgeon in the world, and he Black. You better take her."
So we kept going back to Children's. We didn't have a relationship at Johns Hopkins. We didn't know anybody, and we lived in D.C.
And he wasn't taking new patients.
Right. That's the other thing too.
People were coming from all over the world to see him.
Yeah.
He was totally booked up, no new patients.
Yeah. So we lived right outside of D.C. We lived in Maryland at the time, and so once we were getting to run around with Children's Hospital, they were like, "Oh, well, the shunt's fine, everything's fine. Maybe she's making it up. Maybe she wants special attention." They were saying all this stuff, right? It was like, no.
Oh, and the worst thing was, well, at least she's not as bad as the other patients.
Yeah.
That was the killer. At that point, I said, "No, we can't go back." Because you don't compare her complaining of her headache.
Right.
That's because, like Paula said, you can't tell someone's disability and what's going on inside. You shouldn't have to wave a banner.
Mm-hmm.
If she's hurting, she's had all these brain surgeries, something's wrong. And so she needs help. But to say, well, at least she's doing better than most of, that was unacceptable. And I'm glad that we went, because there was something wrong. Hey, we 21 brain surgeries, now in the bag. There was something wrong. But go ahead.
So what Sherine did, she took her mother's advice. So she said, okay.
And wait, this is a secret and a tip for all of you listening. If you ever have that issue, you can't get into the doctor.
So Dr. Carson, he's not taking any more patients. So what we do, instead of taking her back to Children's, we drive to Baltimore, 45 minutes away. Go to Baltimore, go to Johns Hopkins, and we go in through the emergency room.
Can't turn you down.
And when we went in through the emergency room, who do they call? Because it's a rare case. Now, what I didn't say is that.
And Dr. Carson was the head of all neurosurgery, adult and
pediatric,
children. So that automatically made her his patient.
But one of the things I didn't say, when she was born, we saw over 100 doctors while at Children's Hospital. And the reason why is because the head of neurosurgery, he had all of these doctors come in to study her case because it's such a rare case. And to this day, it became a medical case study. Her case did. And it gave the doctors an opportunity to learn more about Dandy-Walker Malformation. So I'll fast forward. We get to Johns Hopkins. We go to the emergency room. Who do we meet? We meet Dr. Ben Carson. He comes. He was
wow.
He was like, this is so rare. Let's see what we can do. So long story short, him and his team, they do 15 of her out of her 21 surgeries
throughout her life.
Throughout her life. And she didn't have to have the surgeries all at the same, back to back to back. What would happen? She would mainly have to have her surgery if the device broke down. So, but just going throughout her life, as Sherine said, she would miss a lot of school at one time. And both of our kids went through DC public schools. At one time, I remember one school year, she started the school year. By November, we had a tutor who had to come to the house.
The homeschool, DC homeschool. Right. She had 3 of them.
Yeah. So they had to come to the house, just so she can get through the school year.
That was 9th grade, her first year of high school.
When she was much younger, when she was having these, when she was in elementary school, and she was having some of these surgeries, because she didn't have her next set of surgeries until the age of 7.5, 8 years old. One of the things that, she would always have her hair cut, because they just go in and cut off what they need to cut off and then do the brain surgery.
She would look like her dad.
Yeah. So
bald like that.
So she was very subconscious of that. Very subconscious.
Aww.
And so Sherine has a cousin and gave her like these bag of these scarves that you wear in your head. And so the teachers knew and the principals knew, what the situation was. And I remember one day I was taking her to school and she had like done something with her book bag. And the scarf kind of like came off, and there's a bunch of kids around, and they kind of like saw it, and she was like, "Daddy, please, Daddy, please." And it like just ripped my heart out because she didn't be exposed like that. So we got it fixed, and then she went in and she was good. But I will say to people, to parents, other parents out there, regardless of what your situation is, what your child is going through, it's one thing I tell people all the time. If it's me, okay, I'll deal with it.
That's right.
If it's my wife, I'll deal with it. But if my child, I don't want them to have to suffer anything.
Mm-hmm. You're powerless.
And that's right. You're powerless. You feel powerless. And you really have to wait on God, trust God, and just know that He hasn't forgotten you. And I remember when Ashley was in Children's Hospital, I was going through this portion, this season. I was very depressed. Didn't know I was depressed. And I want to say this because I know other people go through this stuff. And at that time, I would never even look at myself as being depressed because of just my thought process of what depression was. Like, that's what we, I'm not that. No, I was depressed.
Wow.
And I was depressed, having this pity party. And I remember We were at Children's Hospital. Ashley was having a surgery. There was a family who had an 8-year-old daughter, had a car hit her on a bicycle, had brain trauma. Sherine was talking to the family. I'm having my pity party. I'm just depressed. I'm sitting in the waiting room because our daughter's in surgery, sitting in the waiting room, and I don't really want to talk to anybody. I'm thinking about me, like, what did I do? What did I do? So when the doctor came out and said, okay, she's in recovery, you can go back and see her. I go back and see her, and here this little 6-month-old, 5-month-old baby laying there, head all bandaged up, and I'm like looking, just like feeling so bad. And as I was walking in that room, there was another family who was going out the other end of that room, and they were all crying. I was like, why are they crying? So it's Ashley and a little girl who got hit by the bike. They were right across the room from each other. The family was walking out because the little girl had just died.
Wow.
And as I'm sitting there looking at Ashley, pitying myself, it's like God spoke to me. Now people, they say, well, God don't speak to me. He speak to me.
I know that's right.
It's like God spoke to me and said to me, accept what I give you. You get to take yours home.
Wow.
They have to bury theirs.
Oh,
from that point on, you ain't had no problem out of Frank.
He know how to snap you out of it.
You ain't had no problem.
He know how to snap you out of it.
Wow.
It's over. Because what I realized, somebody else is always suffering.
Yes.
Wow.
Absolutely.
Be grateful for whatever God gives you. Listen, we would be in the hospital. So whenever we had to go back, we're just, making ourselves available to talk to other families.
It's all about ministry. Even
It's
Ashley
like,
was going room to room to all the kids ministering. She in elementary school and middle school.
And talk to these other families and just try to encourage them, because it's like, okay,
it's
God,
for a purpose. We're here for a reason. So
that is so amazing. I mean, y'all story is really blowing my mind, and I've known y'all for years. This is just amazing. And Frank, I'm so glad that you brought up the fact that you were depressed, because I really wanted to ask, how did all of this affect you guys mentally? So I'm really glad that you spoke on it, because it's real life. That's a lot that you guys had to deal with.
Yes.
And if you would have just told us, oh no, we just prayed and we were good.
Right.
I'd be like, come on now, bring it
Come
on.
on.
I'm really glad, because it helps people to understand that although we're saved, we're praying, we still have to go through some stuff. We still have to carry our cross. And I'm so glad that you brought that up to let people know that, this is real. It's real. But God.
One other thing I will say to that point there, and this is, I want people to know this as well. A lot of times, especially in certain communities, especially our community, when it comes to counseling and things like that, we kind of like, what? No. I remember when Ashley, her pediatrician, at one time, he had asked, because we had developed a good relationship with him, and he had asked us, he said, hey, have you all considered ever so Ashley could get counseling like in a peer group of other kids who, gone having surgeries and stuff like that. And we were like, so I asked him, I said, so, share with me what that would look like. So he talked to us more about it. Then he said, well, what about family counseling? You all ever thought about doing family counseling? I was like, we'd be open to it. And I will say this, we went for a few sessions. I can't remember exactly how many, but it was so eye-opening for me. It really was. Eye-opening, I think, for everybody, because for us to sit around the table and we had a counselor, and the counselor would ask us all how we are doing, everybody has a different perspective.
That's right.
Yeah.
And to hear my wife, to hear Sherine just like pour her heart out and just like, man, I didn't know all that was in there. I didn't know all that was, but it was good because she's able to express herself and, so now I know how she feels. The kids see her in a different light. And then we get to see how the kids feel. How does Trey feel about this?
Right. We didn't even talk about, when did Trey come into the picture?
Nope. No. We're not even gonna do that. And I say this, we have to close out at 9 o'clock. So what
I
I
got
would
you.
ask you guys to do, we
Mhm.
gotta have part two.
Let's do it.
Yes.
Let's
Yes,
do
we
it.
got. Well, I'm telling y'all, I'm sitting on the edge of my seat, and I know all. I mean, it's so many comments coming through,
Oh,
but
really?
when I tell you honestly, we were supposed to be had Sherine them on here. We didn't have them, but when I tell you, this has been awesome, and we haven't even gotten
Yes.
halfway through. We're not going to be able to do it in 5 minutes.
I got
Thank
you.
you.
So what I want to do, guys, we have another spot in October. I
Let's do it.
want you guys back on. I
Okay.
do,
Yes.
Let's do it.
because we
Let's
have
do it.
just scratched the surface. Like Bunny about to go to another place.
Look.
And it's
Look,
like,
I had to lean in. I'm leaning in.
yeah, that's what I'm saying. No, I really, when I say guys, we're gonna stop it right there. But I
I
want
got
y'all to
you.
hear
I got
this. But what I'm happy about is that you guys are pouring your heart out, the realness, the
Yes.
spiritual side, and I mean y'all giving us nuggets from both ends. And I'm like, I gotta hear part two. Hey
Sheree is
guys,
preached
anybody want to
already.
hear part two? Part
Right.
two. Everybody's like, yes, part two.
Yes.
Okay.
Yes,
Yes.
Yes.
yes. When I tell you guys, we haven't even gotten up to her being an adult. Man, we
Right.
supposed to be talking
Yes.
about the business and nah, we
Yeah.
gotta have a part two.
Let's
We
do
Okay.
it.
gotta have a part two. Yeah, Courtney said yes, part two. We all need a part two. What I want y'all to know is we really, really appreciate it. And we told Frank, y'all, we was like, Frank, I told Frank, I said, Frank, I know you don't talk a lot, but I'm gonna need you to come out with something. Frank,
Come
he told
on.
me,
He came
What?
through.
He
When he
don't
gets
talk.
started, I tell you.
yes, yes. But we gotta have guys, we have 2 spots in October. We're gonna put y'all just tell us what Thursday you guys are available. My mother said part two. The last 2 Thursdays at the end of October, we have got to pick back up with this because this is something that people need to hear about. They need to hear that real side. They need
Yeah.
to hear that
That's right.
depression side, that
Yes,
side
I
where
love it.
you're
I
being
love
a parent, but you're also trying to be spiritual. So what
Mhm.
I'm gonna say is thank you guys for sharing your story.
it.
I
Mhm.
look forward to part two. Hopefully we don't have to have a part three, but if we have to,
I
Oh
know, right?
no, it's a
I
lot.
am so enjoying you all's journey. I
Yes.
really am.
That's you.
Bunny and Cookie, I mean Crystal, I'm gonna give you all a chance to close out. Then I want you guys to say something. But I definitely in October I want part two, please.
All right. No problem.
Okay.
Well, I
But
just want to say that I just really appreciate your both of your vulnerability
yeah,
tonight and expressing a lot of parents when they're going through, we always feel alone.
Mhm.
No one else is dealing with this but us, and we feel isolated. And I think that's almost a part of everyone's story. And you share that, and you share that eye-opening moment when God like lets you know, Frank, like, it, I'm telling you, this was just so much tonight to take. We couldn't ask a question because
Right.
you guys shared in such a way that you were answering any question that we was about to say. Well, what about?
Yeah.
It was just, I loved it. I can't wait for part two.
Right.
Bunny.
Right. Right. I mean, we couldn't say anything. Like we just leaned in. Like
Mhm.
there was no questions that we really had to ask because you guys really opened up your pregnancy, the birth, and then young Ashley and that journey and all the surgeries, and then meeting the famous Dr. Carlson. So, oh my goodness, I absolutely fabulous. I love you guys. Been knowing you for so many years, but I had no idea that that was your journey. Now I knew that it was a tough journey, but you guys have been through some stuff. And to see that you guys are still doing it together, I love
yeah,
it. I
Yeah.
love
that's
it.
so important.
I love
Yeah.
it. Yep.
Okay, so guys, I need y'all to contact my mom for the the end of. I'm not even kidding. We got to get this show on again. I really enjoy. I can't tell
To
you
be
all.
continued.
Yeah, see,
I know.
that's
I
what
just
Mother
can't tell you
Barbara
guys
said.
how
She
much
said
I
to be
enjoyed this. I
continued.
really
Yeah.
did. Yeah.
Okay.
So can you guys give us some encouraging words because I did. I'm gonna hook you all up with this parent too that
Okay.
reached out to
Okay.
me. But can you guys give us some encouraging words to close this out until next time?
Okay. One scripture that came to mind was many are the afflictions of the righteous, but the Lord delivereth them out of them all. Keep trusting in God, seeking him step by step. You just acknowledge him in all your ways, and he will direct your path. He has a greater vision. He has a greater plan. He knows it all. You knows nothing. Lean on him and he'll work it out.
Yeah.
All right.
All right. And I will close it out and just say, it's piggybacking off what she said. Whatever you're going through, God's got you. Lean into him. Trust God. God has you. You don't need to see the entire mosaic. We are living as we are living. The pages of our life are being written.
Yes.
And as we get through each season, a page is turned. We don't know what's on that next page, but we just know that we can continue to trust God. And those things that we stand in need of, those things that our children stand in need of, he's going to make a way, open up doors, whatever is needed, God will always provide.
Absolutely.
I
Amen.
love it.
Joyce just said we may need both of those dates in October. The last two Thursdays in October. Joyce said we may need both dates.
Well, thank you guys
Oh,
again.
yeah.
We look
Thank
forward to
you.
you coming on Advocacy again. Thank you for sharing your story. Thank you
Yes.
for gracing us with your presence, and we look forward to part 2.
Our pleasure. Thank you for
Bless
your
you.
awesome platform. And keep up the good work. Thank you.
Yes,
Love you.
thank you.
Thank
You guys
you.
have a wonderful evening. Everybody enjoy your weekend.
All right.
Yes.
All
Bye,
right.
everybody.
Bye-bye.